Chapter 7, Anatomy and Physiology of Pregnancy. Most tested topics: pregnancy dating, maternal physiologic adaptations, reproductive system changes, cardiovascular adaptations, probable signs of pregnancy, fundal height, Braxton Hicks contractions, common pregnancy signs. 1. Pregnancy dating. Know these values. Gestation equals 40 weeks, 280 days, from the first day of the last menstrual period, LMP, 266 days from conception. Trimesters. First, 0 to 13 and 6/7 weeks. Second, 14 and 0/7 minus 27 and 6/7 weeks. Third, 28 and 0/7 minus 40 and 6/7 weeks. 2. Maternal adaptations. Pregnancy adaptations occur because of pregnancy hormones, enlarging uterus, increased metabolic demands. Purpose: maintain maternal physiologic function, support fetal growth, prepare for labor and birth. 3. Uterine changes. Size. Know these landmarks. Non-pregnant uterus, 4 to 70 grams. Term uterus, approximately equals 1,200 grams. Volume. Before pregnancy, 10 milliliters. At term, 5L. Uterus size, 7 weeks right pointing arrow. Large hen's egg, 10 weeks right pointing arrow orange. 12 weeks right pointing arrow grapefruit. Position: pelvic organ during first trimester. Rises into abdomen by 12 weeks. May show after 14 weeks. Fundal height. Remember, palpable above symphysis pubis. 12 to 14 weeks. At umbilicus, 20 to 22 weeks. Near xiphoid process. At term. Drops at 38 to 40 weeks because of lightening. 4. Hagar sign. Definition: softening and compressibility of the lower uterine segment, isthmus, occurs. Approximately 6 weeks. Probable sign of pregnancy. 5. Braxton Hicks contractions. Characteristics: begin after the 4th month. Irregular, painless, do not increase in intensity, do not dilate the cervix, usually stop with walking or exercise. Can be confused with preterm labor. 6. Utero-placental blood flow. Important facts: increases tenfold. At term, 450 to 650 milliliters per minute. Greatest oxygen consumption occurs during the 3rd trimester. Factors decreasing blood flow: maternal hypotension, uterine contractions, supine position. 7. Fetal assessment findings. Ballotment, passive movement of an unengaged fetus. Detected 16 to 18 weeks. Quickening, first fetal movement felt by the mother. Occurs. Multipara, 14 to 16 weeks. Nullipara, around 18 weeks or later. Described as a flutter. 8. Cervical changes. Goodell sign. Softening of the cervix. Around 6 weeks, caused by increased vascularity, mucus plug, functions, seals cervical canal. Rich in immunoglobulins, protects against bacterial invasion. Friability. Cervix bleeds easily after examination or intercourse. 9. Ovarian changes. No. Ovulation stops. FSH and LH are suppressed. Corpus luteum produces estrogen and progesterone during the first 6 to 10 weeks. Placenta then becomes the primary hormone source. Amenorrhea occurs during pregnancy. 10. Vaginal changes. Chadwick sign. Bluish-violet discoloration, cervix and vagina, appears at 6 to 8 weeks. Leukorrhea, normal pregnancy discharge. White to slightly gray. Mucoid, mild musty odor. Pregnancy also. Lowers vaginal pH. Increases lactobacillus. Increases susceptibility to candidiasis. May cause vulvar edema and varicosities. 11. Breast changes. Early findings: tenderness, tingling, fullness, enlarged areolae, darkened nipples, prominent veins, Montgomery tubercles enlarged, striae gravidarum. Hormones: estrogen right-pointing arrow duct growth, progesterone right-pointing arrow lobule development, prolactin right-pointing arrow colostrum production. Human placental lactogen, right-pointing arrow lactogenesis, stage 1. Lactation is inhibited until progesterone decreases after birth. 12. Cardiovascular adaptations. Blood volume increases 40 to 45%. Peaks around 32 weeks. Increase 1,200 to 1,600 milliliters. Purpose: supply uterus. Meet fetal needs. Protect against blood loss at delivery. Cardiac output increases 30 to 50%. peaks 25 to 30 weeks, increases further during labor. Blood pressure. Despite increased cardiac output, BP remains unchanged or slightly decreases because systemic vascular resistance falls. Diastolic BP, lowest between 24 to 32 weeks, returns to pre-pregnancy level by term. Supine hypotensive syndrome. Cause: compression of the inferior vena cava. Findings: hypotension, bradycardia, dizziness, feeling faint. Prevention: left lateral position. Other cardiovascular changes. Common findings: mild cardiac enlargement, heart displaced upward and left. Heart rate increases 15 to 20 beats per minute. Physiologic systolic murmur. S3. Heart sound. Varicose veins. Hemorrhoids. Dependent edema. Increased risk of venous thromboembolism, VTE. Must memorize. Sign: Hagar, Goodell, Chadwick, quickening, ballotment. Finding: soft, lower uterine segment, soft cervix, bluish cervix/vagina. First fetal movement, felt by mother. Rebounding fetus. Braxton Hicks, irregular. Painless contractions. Lightening, fetal descent, before labor. GTPAL system. G equals gravida. Total number of pregnancies, including the current pregnancy. T equals term births. Pregnancies delivered at 38 weeks or later. P equals preterm births. Pregnancies delivered from 20 to 37 weeks. A equals abortions. Pregnancy losses before viability. L equals living children. Example: pregnant for the 4th time. 1 term pregnancy. 2 preterm pregnancies. No abortions. 4 living children. Answer: GTPAL equals 41204. Pregnancy terminology: primigravida, pregnant for the first time. Multigravida, pregnant 2 or more times. Primipara, delivered 1 viable pregnancy. Multipara, delivered 2 or more viable pregnancies. Nulligravida, never pregnant. Presumptive, probable, and positive signs. Presumptive signs: felt by the woman. Amenorrhea, quickening. Fatigue, nausea. Probable signs: positive pregnancy test. Chadwick sign, Goodell sign, Hagar sign. Braxton Hicks contractions. Positive signs: fetal heartbeat, fetal movement, felt by examiner. Ultrasound visualization of fetus. Memory tip: mother feels it. Presumptive. Examiner finds it. Probable. Baby proves it. Positive. Fundal height: 12 to 14 weeks. Just above symphysis pubis. 22 to 24 weeks. Umbilicus. Pregnancy signs: Hagar sign, soft lower uterine segment. Goodell sign, soft cervix. Chadwick sign, bluish cervix and vagina. Ballotment, rebounding fetus. Quickening, mother feels fetal movement. Operculum, cervical mucus plug. Leukorrhea, white vaginal discharge. Hormones: progesterone, maintains pregnancy, relaxes uterus, prevents miscarriage. Estrogen, increases uterine growth, causes nasal congestion, causes vascular changes. HCG, detectable 7 to 8 days after conception, peaks early. Higher levels suggest multiple gestation, Down syndrome, possible ectopic pregnancy. Oxytocin, causes uterine contractions. Cardiovascular changes, normal findings. Pulse increases 10 to 15 BPM. Blood volume increases 40% to 60%. BP decreases slightly in 2nd trimester. Physiologic anemia develops. Cardiac sounds become louder. Purpose of increased blood volume: better placental perfusion. Physiologic anemia. Cause: hemodilution, not caused by iron deficiency. Reduced RBC production. Respiratory changes. Normal findings: nasal congestion, nosebleeds. Voice changes, hearing changes. Cause: increased estrogen, increased vascularity of upper airway. Gastrointestinal changes, morning sickness. Hormonal changes, decreased gastric motility. Pyrosis, heartburn. Tyolism, excessive salivation. Pica, eating non-food items, may indicate iron deficiency anemia. Urinary changes, normal, frequency. Small glycosuria. Abnormal, proteinuria. Bacteria. Ketones, best kidney position. Lateral recumbent. Skin changes. Striae gravidarum. Stretch marks, fade but never disappear completely. Cloasma, mask of pregnancy, usually fades. Telangiectasia, Spider veins usually disappear after birth. Musculoskeletal changes. Normal, increased lordosis. Center of gravity shifts forward. Increased pelvic joint mobility. Decreased muscle tone. Braxton Hicks contractions. Characteristics: painless, regular. Do not dilate cervix. Improve with walking. Improve placental blood flow. Pregnancy timing, viability, about 22 to 24 weeks. Preterm, 20 to 37 weeks. Term, 38 to 42 weeks. Postterm, greater than 42 weeks. Breast changes: normal, blue veins visible. Mammary glands mature by mid-pregnancy. Colostrum may be expressed before birth. Lactation begins after birth when estrogen falls. Normal pregnancy adaptations: quickening, first fetal movement felt by mother. Lightening, fetus descends into pelvis. Ballotment, fetus rebounds after palpation. NCLEX facts: false positive pregnancy tests. Anticonvulsants may cause false positives. Appendix during pregnancy moves upward and to the right. Hemorrhoids and varicose veins, caused by uterine compression of iliac veins and inferior vena cava. High-yield NCLEX memorization list. GTPAL equals gravida, term, preterm, abortions, living. Amenorrhea is a presumptive sign. Positive pregnancy test is a probable sign. Fetal heartbeat confirms pregnancy. Heger sign equals soft lower uterine segment. Goodell sign equals soft cervix. Chadwick sign equals bluish cervix. Progesterone maintains pregnancy. Estrogen causes nasal congestion. HCG is detected about 7 to 8 days after conception. Fundus is above the symphysis pubis at 12 to 14 weeks. Umbilicus is reached at about 22 to 24 weeks. Blood volume increases 40% to 60%. Physiologic anemia is caused by hemodilution. Pica suggests iron deficiency. Small glycosuria may be normal. Proteinuria is abnormal. Braxton Hicks contractions are painless and do not dilate the cervix. Striae fade but never disappear completely. Viability begins around 22 to 24 weeks.